Thank you for staying with us. We will start our webinar shortly. Good afternoon. Thank you for staying with us. We shall start our webinar now. Good afternoon to Dr. Jilt, Dr. Noring, Madam Josephine, fellow friends, and all the guests of honors. It gives me great pleasure to serve as moderator for today's webinar. I'm Chung Soo Ching, and on behalf of the organizing committee, I would like to send a heartfelt greeting to everyone here. We appreciate you taking the time out of your hectic schedules to join us today. We hope you find the program we have planned for you to be beneficial and engaging. We are now ready to begin the webinar proceedings. These sessions will begin with the national anthem, followed by a prayer. I would like, therefore, to ask everyone to be in a respectful posture for Malaysia national anthem, Negaraku. May I now invite Madam Josephine Stephens to lead the invocation.
Thank you. Let us bow our heads and put ourselves in the presence of our Lord. Dear God, thank you for the blessings you have bestowed upon us. We are truly grateful for them. Thank you for allowing us today to meet and share our knowledge and time with one another in this webinar. May you extend your divine wisdom to our speakers so that she would be able to impart effectively her God-given knowledge to all of us. May she be blessed as she continues to bring her expertise to people who need them. Bless the participants as well, so that they would be able to glean the vital information from this activity. May you bestow your blessing after this webinar, so that we may go out and spread what we learn in the spirit of your love and generosity. May we realize this activity should glorify your name. Amen.
Thank you, Madam Josephine. Without further ado, please allow me to introduce our guest. We are honored to have Dr. Noring John to provide the opening remarks. Dr. Noring John is the former Director of Nursing in the Ministry of Health, Duchess of Kent, Sandakan. She is currently the head of department at Lincoln University College Recruitment Center in Sabah. Ladies and gentlemen, please join me in greeting Dr. Noring John.
Thank you, Ms. Chung, for the kind introduction. Good afternoon, everyone. How are you? Everyone okay? Fine?
Good. Yes,
Good afternoon. Respected participants, colleagues. Very good. respected participants, colleagues, fellow students, ladies and gentlemen, and distinguished presenter, I'm pleased to welcome you to the webinar, Nursing Practice Challenges Towards Quality Patient Care. This webinar aims to address the quality of nursing care practice to maintain patient safety. In this virtual conference, I noticed that I can recognize some names of participants from the government sector, other sectors. Ladies and gentlemen, I believe you have worked tirelessly with stamina, resilience, practicality, and perseverance during the COVID-19 pandemic for sustainability in spite of the inequity. To quote the opening remarks of WHO Director General in 2021 Health Equity webinar, he said, "The hard truth is that some of these people died simply they could not get the care they needed because of where they live, who they are, and how much they earn, and the pandemic worsened the situation." Ladies and gentlemen, we all understand. We understand the importance of quality practice in our day-to-day nursing life and ways in which we transform the nursing world. In line with the new theme of International Nurses Day, year 2020, nurses, a voice to lead, invest in nursing, and respect rights on secure, which need to support and invest in nursing profession to strengthen health systems around the world. Ladies and gentlemen, in this webinar, there are 7 speakers conceived of student talk master in nursing educations. I'm proud to present them to you today that they're going to share the compilations of study, case studies, and search during the periods of study at Lincoln University College in this program, Master in Nursing Educations. Looking at their reflects the works of nurses to start for patient, to care for patients during the COVID-19 pandemics in medical safety in the face of the pandemic, burnout, understaffed during pandemic, improved nurses' safety wearing proper personal protection equipment during pandemic, challenges of mentorships towards nurses during pandemic, challenges in CPR training of nursing students, quality improvement, reducing pressure, injury occurrence in ICU, and also, last but not least, they're going to present to you also to us during this web seminar, Nursing Education Approach During Pandemic. Ladies and gentlemen, I hope that this webinar sharing knowledge can increase nurses' self-confidence, knowledge, critical thinking ability, and improve interpersonal skills to satisfy client expectation. This is very important. I repeat, to satisfy client expectation and sustaining the outcomes of quality. So ladies and gentlemen, science, technology, innovations, and quality nursing practice are indispensable for our response to the recovery from the crisis. Therefore, there is no single interventions for optimizing quality care to maintain patient safety. Thus, we have to focus on the need to protect, support, and invest in nursing professions. Professional nursing is a major driver of improving patient care. Effective nursing care, practice with effective health policy, and a patient's business nursing model, I believe this may strengthen our health systems around the world to be able to withstand the next pandemic. So, to everyone here, us today, and to the respected presenter, wish you all the best. Thank you. Over to you, Ms. Moderator.
Thank you, Dr. Noreen, for those wonderful remarks. Ladies and gentlemen, it gives me a great pleasure to now introduce to you our first speaker, Ms. Chung Soo Chin. Ms. Chung has 22 years of experience as a nurse. She works as a clinical instructor at University Malaysia Sabah. She had attained her post-basic in coronary care nursing and her bachelor degree in nursing. Ladies and gentlemen, please welcome Ms. Chung. Ms. Chung, maybe you need to unmute your mic, please. Thank you.
Right, thank you, Ms. Janet, for the kind introductions. Sorry for the technical problems. Good afternoon to Dr. Noreen, Dr. Jill, Madam Josephine, my fellow friends, and all the audience. Thank you for joining us in this afternoon program. And here I'm going to share about the challenges in CPR training of nursing students. As you know, CPR is a life-saving skill that everyone should learn. We have all been taught on performing these important skills during our nursing course. And the ultimate goal of CPR is to optimize cardiac arrest victims' chances of survive. Sudden cardiac arrest is the leading cause of death. And despite the advancements of the medical science, the cardiac arrest survival rate remained poor. In 2015, approximately 350,000 adults in the US experienced non-traumatic out-of-hospital cardiac arrest, and approximately 10% of these patients survived their initial hospitalizations. Among these 10% survivors, less than 40% of them will receive layperson-initiated CPR, and the general public apply an AED on cardiac arrest victim is only 12% of the cases. Let us look at the cases admitted to hospital suffer in-hospital cardiac arrest. Only 25% of the patients were discharged from the hospital alive. Survival from cardiac arrest depends on a sequence of interventions. The time between the onset of cardiac arrest and the provision of care determines the likelihood of survival. If treatment is not provided within 10 minutes, the survival rate is close to 0. The chances of the victim's survival decrease if any steps in the chain of survival are missed or do not done properly. Survival after cardiac arrest requires an integrated system which involves people, training, equipment, and also involvement of organizations. Without the commitment at every level of care, it is impossible to achieve a successful resuscitation outcome. There are challenges in implementing each of these elements. From the perspective of nursing students, I will discuss more on the CPR training portions. As per curricular, CPR training on nursing students aims to provide the knowledge and skills needed to competently manage patients experiencing life-threatening conditions during their clinical practice in hospital. CPR training on nursing students usually focus on the essential step in carrying out DRCAB, which includes early recognitions of cardiac arrest, activation of emergency response, perform high-quality CPR, and delivery of defibrillations. The provisions of CPR has long been the hallmark of cardiac arrest management. AHA 2020 guidelines reaffirms the need for early initiations of high-quality CPR among healthcare providers. And performance of high-quality CPR includes adequate compression depth and compression rate while minimizing forces in compressions. And early defibrillations with concurrent high-quality CPR is critical to survival when sudden cardiac arrest is caused by VF or pulseless VT. Therefore, acquisitions and retentions of these two important skills determine nursing student ability to competently practice this skill in the hospital setting. At my workplace, we are using AHA guidelines for CPR training among nursing students. The AHA guidelines provides a comprehensive review of evidence-based recommendations for resuscitations and emergency cardiovascular care. This guideline also serves as the global source of the official resuscitation science and education guideline used by training organizations and healthcare professionals. Effective education is a key variable in improving survival outcomes from cardiac arrest. Without effective education, healthcare providers and lay rescuers would struggle to consistently apply the evidence-based treatment of cardiac arrest. This is the Epstein's formula for survival, which emphasizes the three components essential to improving survival of sudden cardiac arrest, which includes medical science, educational efficiency, and local implementations. Advances in technology enable shaping the future of education, and innovative learning solutions are essential to facilitate effective and accessible training. Various instructions design features were recommended to ensure the highest quality of care and improve outcomes. The instructional design listed here is the key element contributing to educational efficiency. These instructional designs are the most significant and impactful new or updated recommendations which based on the extensive reviews of the scientific evidence. Study has been carried out to examine the ability of the learner to perform CPR with the use of this new instructional design compared to that of traditional teaching method, which is instructor-led method. Let's look at some of the studies that examine the knowledge acquisitions among nursing students following CPR training. Disregard the teaching method used in this study as we compare the pre-test and post-test score. This study shows significant increase in the mean score of knowledge among nursing students following CPR training. If you look at the teaching method, study done by Ekel and Ahmad 2014, the intervention group using high-fidelity simulator have a significant higher mean score in CPR knowledge at the acquisition phase with mean score 12.67 compared to 11.22 in the control group, which using low fidelity simulator. However, results show in Elieri et al. 2019, the mean score of knowledge acquisitions were not statistically significant between the instructor-led and concept-map group. And the same study by Elieri et al. 2019, examining the skills acquisitions, the pre-test and post-test score indicated significant increase in the mean score of skills acquisitions, and also was significantly higher in the concept map group. All this study indicated that the discard of teaching method, learner knowledge and skills acquisitions significantly increases following CPR training. Now, the question is, to what extent are the theoretical CPR knowledge and skill taught during training among nursing students are retained as hands-on competency? Findings from several studies attest that learners demonstrate poor knowledge skill retentions within weeks of completing the CPR course, and nurses' CPR skills tend to deteriorate over time. Let's look at the same study that examines the knowledge and skills retentions among nursing students following CPR training. Disregard the teaching method as we compare the post-test score and follow-up test after 1 to 3 months. This study shows significant decrease in the mean score of knowledge retention. If compared between the teaching methods in ECHO and Ahmad 2014, the intervention group using high-fidelity simulator demonstrate higher knowledge retention, which is 12.2 compared to 10 in the control group. However, there were no significant difference in knowledge retentions between the instructor lead group and concept map group in Elieri et al. 2019 study. And the same study examining the skills retentions of nursing students following CPR training, there was significant decline in the mean score after 3 months of follow-up tests. In ECHO and Ahmad 2014, the intervention group using high-fidelity simulator demonstrate higher skills retentions, which is 12.8 compared to 10.31 in the control group. All this study indicate that the discard of teaching method, learners' knowledge and skills retentions significant decline over time, thus affecting their competency in performing CPR with the risk of compromising the quality of patient care. To date, inadequate CPR knowledge and skills retentions and competency level among nursing students remain the challenge for educational institutions. As indicated in some of the literature review, retentions of CPR knowledge skills acquired during training significantly correlates with subsequent improvement on hands-on competency. However, numerous studies indicate that student nurses' performance are generally deemed ineffective or incompetent, and it is mainly due to failure or lack of practice and lack of opportunity to perform CPR in the clinical setting. Numerous studies have been carried out to compare the efficacy of different teaching methods. However, there is a lack of consistency in research methodology, subjects, and outcomes in comparing all these teaching methods. Study incorporating a serious game, deliberate practice, mastering, learning, simulation-based model into training demonstrated improved learner performance in resuscitation skills retentions and increase their competency level. If you want to know which instructional design most impact educational outcomes or performance in training of nursing students, there is no definite answer to this. It depends on the facilities and resources available in each educational institutions. In conclusion, CPR training should be based on current evidence-based guidelines, and remedial training must be provided as often as required to examine nursing students' CPR knowledge and skills retentions and competency level. And selections of content material and method of delivery of the course should according to learner abilities and resources available. With that, I end my presentation here. Thank you.
Thank you so much, Ms. Chung. It was an educational and timely presentation. Now, ladies and gentlemen, if you would want more information about Ms. Chung's presentation, you're please welcome to enter your question, your recommendation, even your comment in the chat box. The speaker will be pleased to answer your question shortly. Okay, So let us now move on to our attention to the next speaker, Ms. Jamaica Augusta Jagre. Ms. Jamaica is a registered nurse with 10 years experience in the nursing field. She worked in the neonatal intensive care at Gleneagles, Singapore. She had a post-basic in neonatology as well as a bachelor degree in nursing majoring in critical care nursing, pediatric nursing, and renal nursing. She is also a certified BLS and first aid instructor under the American Heart Association, LSEC, and AHCOE. Ladies and gentlemen, please welcome Ms. Jamaica. Over to you, Ms. Jo.
Thank you so much, Janet, for the kind introduction. Good afternoon, everyone. Ladies and gentlemen, thank you so much for taking your time to attend our seminar. So for today, the title of my topic is Burnout and Stress Understaffed Nurses During the Pandemic. So the objective of my topic today is to identify factors leading to further shortage of nurses during the pandemic, and also to understand the impacts of understaffing during the pandemic. And the third objective is to identify proper measures to cope with burnout and stress among understaffed nurses during the pandemic. So this topic is familiar to all of us because shortage of nurses is not new, and it does not only occur because of the pandemic, okay? So shortage of nurses is actually a global issue, and it persistently happened actually since the Crimean War. So in 1954, Florence Nightingale and 38 nurses, they were really outnumbered because there were so many British soldiers that were wounded, and they were suffering for sickness that was spreading during that time, during the Crimean War. So nursing is actually highly on demand, and it is on demand globally. So it is safe to say that actually almost all healthcare workers worldwide claim to be understaffed. So why is shortage of nurses persistent and it is worsening during the pandemic? So it is persistent, and a study shows that hospital, they would rather invest in advanced medical technology than recruiting more nurses. And it's worsening because despite annually the hospitals and there are so many nurses graduate, hundreds of nurses graduate annually, but it is also not enough to compensate with the high rising cases during the pandemic, basically. Yeah. So nursing, as we all know, it is a strenuous profession due to the specific nature, and to be understaffed during the pandemic actually increased the nurses' workload. So this understaffing, it is identified as major stressor to nurses' work life. To make matter worse, these stress understaffed nurses have to work overtime during the pandemic due to the rapid rises of COVID patients. So some of these nurses and medical personnel were unfortunately exposed to this deadly virus. So therefore, they have to be quarantined, admitted, and treated with long hospital leave. So the remaining nurses, they have to cope with the current situation. So these nurses, they have inadequate rest, and they have close interval rotating schedules, and those heavy workload gets heavier during their shift during the pandemic. So being understaffed during the pandemic creates new kind of burnout. So according to American Institute of Stress, stress is actually one of the major contributing factor leading to 80% work-related injuries. So this, I would like to share with you the statistic of nursing staffing in Hospital X in 2020. As you can see, from the month of January until December, the hospital actually put in effort to hire nurses, as you can see here. Yeah, but it is being, but then if you can see, the attrition is actually higher. Okay, the amount of nurses resigning and leaving the hospital is actually higher compared to the newly hired statistic of newly hired nurses in that hospital. So this is one of the reasons why understaffing keep on occurring in this hospital up until today. So we also asked nurses that are working in the hospital, their opinions on this understaffing during the pandemic. So nurses A said that we work 7 to 8 hours straight, and working overtime due to the high rise of COVID cases. So sick leaves rates are high because the nurses are tired and annual leaves are being put on hold, okay? So staff nurse B say that 6 of her colleagues resign because with the same heavy workload, they get better salary and position from other hospital. Everyone have financial need and personal issues during this pandemic. Plus, these hospitals are also desperate because they are also understaffed. Staff nurse C, 3 of my colleagues resign because of family matters. They go back to their country because they are small children and sick parents due to COVID. Money is nothing compared to the family well-being. So next, I will walk you through to the impacts of shortage of nurses during the pandemic. So there are 3 main categories. So the first one, poor quality of care and service provided. Okay, so the second one is worsening nurses' physical and mental health, such as chronic burnout and long-term stress. And the third one, poor nurses' performance and decreasing work quality and efficiency. So first, we will look into the first one, which is poor quality of care and services provided. So according to K. Kale et al. And McAfee et al., both in 2018 and 2017, they shared that on daily shift with heavy workload, it has been reported that nearly 6 times higher incidence of patient fall on weekly basis. Okay. So they also shared that there is actually increase of medication error due to a high level of patient acuity. So Glad et al. In 2017 also shared understaffing leads to adverse event in hospital. Okay, so such as medication error, patient falls. Okay, so Posh Hokshan et al. In 2010 also shared that poor quality of care is associated with nurses' emotional, mental, and physical exhaustion, and it is these were reported in countries such as United States, Canada, United Kingdom, Germany, New Zealand, and also in Japan. So next, we will look into the second impact, which is worsening nurses' physical and mental health. So we are talking about chronic burnout and also long-term stress. So Paulson in 2018, so Paulson shared that there are undesired incidents such as patient fall due to understaffing. And it caused stress to these nurses because they have to undergo prolonged investigation by the hospital because the hospital would like to find out what is the root cause. They are doing root analysis, and they have to write report on what actually happened during those incidents. And this also stress the nurses because they will be receiving warning letter and even more serious action such as disciplinary action and also termination. So these nurses are very stressed throughout this procedure. So Bill Letter Component and Freden in 2005 also shared that higher acuity patients require more care and procedures. Thus, shift will be more tiring and stressful. So furthermore, if let's say one of the staff nurse, they fall sick, they take MC and they cannot find replacement. So the rest of nurses from the previous shift or upcoming shift, they have to work double shift. So this double shift and let's say if one of their colleagues takes sick leave, these nurses actually have to cope, and this will cause them to be more stressful and burn out. So Gracia et al. In 2019 shared that high level of burnout due to physical and psychological overload, more sick leave, pressure, and resign due to mental health and physical condition. Okay. So Abramson in 2022, this year, shared that this year is actually the 3rd year for pandemic. So stresses become more persistent and heightening everyone's risk of burnout. Burnout is a syndrome resulting from workplace stress that has not been successfully managed. Nurses will feel energy depletion or exhaustion, increased mental distance and negativism to their job, and also reduce professional efficacy. So actually, according to Abraham in 2002, 79% of their employees claimed to experience work-related stress. Next, we'll come to the third impact, which is poor performance and also decreased work quality and efficiency. So Lazetta et al. In 2020 shared that the worst mean staffing reported in New York City is 3.3 to 9.7 patients per nurses. Okay, so Malgahesh et al. In 2013 shared that higher patient to nurse ratio will decrease the patient satisfaction level with the provided care. So in Brazil, one nurses in a shift actually have to take care of 27 patients. So they become really tired, and this will also lead to poor performance and also reduce the quality of work. Okay, so this Malgahesh also reported that they have been reported of high absenteeism and also turnover because the nurses were too fatigued and also too ill. So Huang 2021 in California shared that good patient to nurse ratio will improve the patient safety and also will reduce nurses burnout. So now we come to our third objective. So how do we cope with understaffing, stress, and burnout at work? So Bogart et al. In 2017 shared that it is important for nurses to set the priorities to solve problems. So basically, nurses with higher experience or competency, whoever is in charge during that day should assign a patient with higher acuity to nurses with more experiences. Okay, so that priority can be set and work can be delegated accordingly, according to the nurses' experience and what they can do during the shift. So Angar and Bloomfield et al. In 2017 and Mariniak in 2018 also shared that it is important for nurses to have effective time management. Why? Because it will improve work quality and it will lessen the nurses' level of stress, such as they will also will have enough time for breaks and to eat and to drink water. Anga et al. In 2017 and Nanyak in 2018 also shared that organization prioritization and also delegation during work is very important among nurses. Okay, so Sir et al. In 2015 shared, okay, in one of the hospital, they actually practice patient classification system, also known as PCS, where the nurse manager plan the nursing staffing and accurately determine the nurse-patient ratio. This will actually help the nurses to experience lesser stress during their shift, and they also can provide proper care to their patient because of the number of the patient OPT and patient ratio to each of the nurses that's working during the shift. So lastly, we'll come to Abrahamson in 2022. He said that stress reducing measure should be at the top of the employer's mind. So a University of Missouri in School Medicine is currently working to launch a physician leadership development program that will hopefully prevent downstream effect and burnout in healthcare setting. Okay, so it is very important also for physician and employer to pay attention and to start listening to these nurses about their needs and to be flexible when responding to these nurses. So as conclusion, pandemic is actually a very long-term battle. We don't know exactly when this pandemic will end, even though few countries are entering endemic right now. So therefore, understaffing among nurses should be addressed by healthcare administration and management. They can do interventions such as recruiting more nurses and retaining senior nurses from resigning. Yeah. So nurses, we also need to take care of our mental health, emotional health, and our physical health also. So we should start seeking professional help if we feel that we are too mentally exhausted, if we start to have anxiety, if we start to have depression after work. And we should also have self-help technique. Self-help technique meaning we go for exercise, we meet up with friends, and we also, if let's say we are foreign nurses working in foreign country, we can keep calling our family and to get their support also, even though we are far, we can do so with the technology platform that we have right now, video calling them through WhatsApp. Okay. So these are my references for today's topic. With that, I end my lecture and my presentation for today. And if you have any question, feel free to ask me and I will be very happy to answer you. Thank you so much for listening to my presentation today.
Thank you very much, Ms. Joy Michael. It was a very precise and pertinent presentations. And again, if you would want more information about her presentations, please answer your questions, comment, recommendation in the chat box. The speaker would be pleased to answer your questions. And in the chat box, there is a questions addressed to me, which sound like, do you have in-house training in your workplace and how you manage it? From Miss Anastasia. Yes, in my workplace, we do have in-house training yearly for supporting staff, and the training led by a team of emergency medical specialists. However, it was withheld at the moment due to MCO and the COVID-19. And occasionally, this team will invite nurses to help up in the training also. Okay. And also there is a questions addressed to Ms. Jamaica. I would like to ask, how does your institutions handle staff stress and burnout that comes with working in a hospital environment during this challenging time?
Okay, thank you so much for the question. So basically in my hospital right now, they are really being supportive because with the strict how to say border, it was not open for 2 years. So what they did is that, right, they gave us free food, free lunch. So all of the nurses are gaining weight. Okay, and then they also gave us appreciation bonus. They gave us bonus. I remember in April we received $2,000 bonus. And also we receive again in July and also in October. Yeah, so they're very kind with that. And on top of that, even though we cannot fly out of the country, we also take turn to clear our AL. So within that 1 week, they will make sure that we are well rested. And they also gave us money to bond with our colleagues. Yeah, so the hospital was so kind to do that. We also have a support system, mental support line, where we can call the psychology, our physicians, and whoever it is to help us so that we can verbalize out our feelings throughout the pandemic. Yeah, thank you so much.
Thank you, Ms. Joy, for your answer. I hope we can answer your questions, Ms. Janet. And
yes, thank you.
Okay, now I would like now to introduce our next speaker, Ms. Janet Lee Zifong. Ms. Janet has been a registered nurse for 27 years, and she received her nursing education from ILKKM in 1995, and in 2009, she earned her postbasic certificate in critical care cardiopulmonary nursing from IJN, as well as a bachelor degree in nursing study in 2014. Ladies and gentlemen, please join me in welcome Ms. Janet Lee. Over to you, Ms. Janet.
Thank you, Ms. Chung, for the kind introduction. So good afternoon, Dr. Duke, Dr. Noreen, Madam Josephine, my fellow coursemates, and all nurses participating in this virtual seminar. This afternoon, I will address a topic of concern titled Challenges in Maintaining Medication Safety in the Face of Pandemic. The learning objective for today's topic are as follows: to comprehend how medication errors pose a significant risk to patients and identifying emerging challenges that contribute to pandemic-related in maintaining medication safety issues. Medication use has become increasingly complex in recent years as the number and variety of drug accessible has increased significantly. Medication have several methods of administration and effects. The same formulation of a certain drug may be sold under more than one trade name at times, which can cause confusion within the nursing workforce because nurses administer the majority of medication prescribed in hospitals. Now, as we know, errors happen at all levels of healthcare workforce. Anyone, even the most experienced and dedicated professional, can be involved in the medication error. Errors resulted from a sequence of events and tend to fall in recurrent pattern regardless of the staffs involved. According to Aronson 2009, medication administration errors pose a severe risk to patient safety, resulting in an increased rate of morbidity and mortality. Medication errors, according to Kurunziza et al. And MNED, are an avoidable act that contributes to the failure of proper medication usage in the treatment process, resulting in harm to the patient to the point of disability and death. In their studies, Chiang and Pepper 2006 cited that the Taiwan Joint Commission on Hospital Accreditation 2004 approximated 6,000 to 20,000 deaths have occurred each year as a result of medical errors, and medication errors made up for 10% of medical lawsuits in Taiwan in 2003. And in the US, an estimated medication administration errors cause about 7,000 deaths yearly and about 400,000 cases of preventable harm per year, which cost US $3.5 billion. The World Health Organization said in 2017 that the annual global cost of medication errors was expected to be US $42 billion, accounting for 0.7% of total health expenses. Furthermore, a British report on the prevalence and burden of medication errors published in 2018 projected that 237 million medication errors happen at all stages of medication administration. In Finland, 700 to 1,700 individuals died each year as a result of medication-related errors, according to Mohajan. And in this study conducted in 5 provinces in Canada by Baker et al. 2004, was also featured in the Walrus article in 2012. In their findings, 3,745 charts were reviewed and found that 360 adverse events identified in 255 patients. 24% of the adverse events were related to medication or fluid administration, and 37% of adverse events were determined to be preventable. This study identified that 7.5% estimated about 187,500 patients in Canadian hospitals experienced adverse events as a result of their care. The death as a result of medical error, as many as 9,250 to 23,750 people in Canadian hospitals were preventable. Now, medication administration errors can arise due to failures in any of the 10 rights, which include the right patient, the right medication, the right dosage, the right timing, right route, right to an education, right to refuse, right assessment, right evaluation, and right documentation. Aside from the failure in any of the rights, medication errors can also take place at any given stages or processes, such as during prescribing, ordering, transcribing, dispensing, preparing, and administering. So what are the challenges that we are currently facing in ensuring medication safety in the midst of COVID pandemic? We are aware that medication errors have become a worldwide issue, and according to a study conducted by Kurunziza et al., 18.7% to 56% of hospitalized patients experience medication administration errors, with patients experiencing this problem accounting for 60% to 80% in Australia and 64% in Nigeria. And according to Veselic, the impact in low and middle income nations is approximately twice as much in terms of the number of years of healthy life lost. In addition to that, the COVID-19 pandemic has had a profound impact on healthcare system, which may increase the risk of error with shortages in nursing workforce, as mentioned by Ms. Jamaica just now, resulting in high workload and burnout. shortages in resources such as PPE and equipment such as smart pumps, and drug shortages are reported by the Institute for Safe Medication Practice in April 2020 and Evans 2020, and as well Agency for Healthcare Research and Quality 2020, especially pointed out that challenges associated with medication shortages was a concern. Now, the ISMP recently published newsletter in April-May 2020 highlighted the challenges in maintaining medication safety during the COVID-19 related medication era, such as failure to engage barcode medication administration due to nursing staff shortages, and staff changing where staff were being redeployed or deployed to unfamiliar work environment and unfamiliar with the usage of barcode system. Difficulties such as being unable to wait patient for correct doses due to lockdown resulted in the healthcare institution resolve through telehealth or virtual review or virtual follow-up, with concern arising where recent and accurate weight could not be obtained, especially for specific drugs that required to be calculated according to patient's body weight. Medication errors due to shortages and the introduction of new drugs with greater concentration, and staff were unfamiliar with the side effects and adverse event was a concerning issue. A study published in 2020 by Taylor et al. Claimed that 36% of incidents had more than one associated factor with patient safety concern within COVID-19 related events. Other serious challenges were faced, such as drug labeling confusion, particularly with regard to drug supplies for emergency use during COVID-19, as documented by ISMP. With issues of insufficient drug supply, some health institutions resolved to use other drugs or new drugs that nurses were unfamiliar with. And as reported, with nursing staff shortages, nurses being burned out, frequent interruption, rehiring retired nurses who may not be familiar with new drugs and new equipments, especially like smart pump infusion, hiring inexperienced or fresh graduated nurses without supervision, and the fear of infection transmission are all part of the concerning risks and challenges during this unprecedented time span. Now, according to Lasata et al., about half of the nursing workforce in 2 hospitals concerned about patient safety was expressed by 49% from medical surgical, 46.7% from ICU. Nurses also indicated that their work was frequently interrupted and delayed due to insufficient staff, which includes 65.3% from medical surgical and 57.4% from ICU. Other concerning findings from the study included 39.3% from the medical surgical staff and 40.9% the ICU staff reported missing supplies or broken equipment, while 40.6% from the medical surgical staff and 31.8% ICU staff reported missed medication on time, and 38.6% from medical surgical and 39.4% from the ICU reported of missing medication. So these are the result analysis outcomes by Lasata et al. Now, another interesting report by ISMP Canada 2020 and Shah et al. 2020, they reviewed an approach to tackle staff and resources shortages during the pandemic by moving IV pumps outside the corridor using extended tubing and multiple IV lines. According to their findings, a reported occurrence in which IV push hydromorphone was ordered and the medication was delivered through one of the many lines designated to noradrenaline resulted in a dramatic spike in the patient's blood pressure. Confusion in several IV lines and IV pumps located outside the patient's room, combined with the use of extended tubing, poses a risk of medication errors. There is a need to carefully assess the risk of putting IV pumps at the corridor in order to limit PPE usage during COVID-19. Now, these are the photographs taken from the review, an approach to address manpower and resources shortages during the pandemic by placing the IV pump outside the corridor, utilizing longer tubing and several IV lines connected through the door entrance to the patient room. If you want to learn more about this study undertaken by ISMP Canada and Shah et al., the link is available below. Same, this photo was taken during the review as well, showed that the usage of multiple extended tubing connected with three-way connector secure externally and without any labeling during the COVID situation. Now, according to the review, Shah et al. Identified other relevant hazards in relation to IV pumps situated outside with extendable tubing, such as required greater amount of drugs and carrier fluids, which may cause medication to be delivered to the patient and patient response to be delayed. There is also the prospect of higher medication waste due to the lengthy extended tubing during a time of potential shortages. Issues such as IV line resistance and the effect of caliber size on rate accuracy because of the reduced size and rigidity of the transducer extension tubing, greater pressure associated to resistance were observed. When a high rate infusion of more than 300 mL per hour delivered through long, narrow tubing may increase the number of false occlusion alarm, and a low rate infusion less than 5 mL per hour may delay the time required to develop pressure, thus activate the occlusion alarm, resulting in a delay reaction to patient. So with long tubing hanging down or unintentionally on the floor, there is also an increased risk of infection, as well as the possibility of staff tripping and injuring themselves. As a result, Shah et al. Through this review advised that the risk of placing IV pumps with the usage of extended tubing outside the patient's room be carefully balanced against the advantages. Given the shortages of personal protective equipment and the significant risk of healthcare professional exposure, relocating IV pumps outside the patient's room may be explored, but then more data are required on the advantages. To summarize, when used sensibly and effectively, medication can significantly improve health. Nonetheless, medication errors are prevalent, resulting in avoidable human suffering and financial costs. Because of the significant increase in the number of critically ill patients admitted to hospital as a result of the COVID-19 pandemic, some organizations are already experiencing unprecedented shortages of staff, medicine, and even resources such as PPE, IV pumps. The pandemic has also resulted in new initiatives, new ideas regarding how medication are prescribed, dispensed, and administered to facilitate ongoing access. As a result, foundational patient safety measures remain applicable in addressing this rising challenge in medication safety. In order to respond to the World Health Organization's medication safety challenge, detailed study on medication safety during a COVID crisis is required as potential areas of focus for healthcare facilities as they build best practices for safely caring for patients in the face of concern about the spread of COVID-19. As a result, ISMP and WHO are urging a greater focus on medication safety challenge that do not cause harm, as well as an avoidance of the blaming culture in this challenging time. The World Health Organization declared the patient safety campaign, Medication Without Harm, to push for patient mistreatment associated with unsafe medication and endorse patient safety as a global health concern. The goal was to develop commitment, involvement, and prevention strategies that would reduce the severity and avoid medication-related harm by 50% in 5 years, which this year marked the 5th. So therefore, ladies and gentlemen, I leave this challenge to all of us. This brings my presentation to a close. Thank you for your attention. If you have any question, Please do not hesitate to post it in the chat box. I will be happy to answer. Thank you. Over to you, Ms. Chung.
Thank you, Ms. Janet. It was very enlightening and insightful presentations. Again, if you have any questions or any things that more information you want to know about from her presentations, you can put inside the chat box. Now, let us move on to the next speaker, Ms. Lini Pindi Johari. Ms. Lini is a registered nurse with 18 years of experience, 5 years of which were in the education field. She earned her diploma in nursing from Penang Adventist College of Nursing in 2003. Her bachelor degree in nursing from Monash University in 2007, and her post-basic in midwifery from ILKKM in 2017. Ladies and gentlemen, please welcome Ms. Lini Pindi Johari. Over to you, Ms. Lini.
Thank you for the wonderful introduction. Good afternoon. Maureen, Madam Josephine, all that it brings: suffering, fear, pain, and death. The emotional, physical, and mental trauma that nurses and frontline caregivers are enduring in this pandemic crisis is enormous. In early 2020, the coronavirus appeared, an invisible, ruthless killer, driving vast numbers of people into hospital around the world. COVID-19 has caused the world to begin to think differently, react quickly, and for nursing leaders lead differently. The objectives of my talk today are to explain the definition of mentorship, to state the benefits of mentorship, to discuss the challenges of mentorship towards nurses during pandemic, to explain the strategies to nursing mentorship during pandemic, and to discuss the recommendation of mentorship towards nurses during pandemic. What is mentorship? Mentorship is very important for the junior nurse to carry out the responsibilities to practice efficient patient care. Mentorship is an activity of giving a younger or less experienced help and advice over a period of time, especially at work or school. Mentoring is an important strategy to help recruit, retain, and develop nurses with critical care expertise. As Susan 2021 mentioned, mentors' role is to provide guidance, support, foster networking, bring a positive attitude to the mentoring experience, establish rapport with mentee, and connect with mentee on a professional level in order to identify with the mentee's needs and demonstrate and assist the mentee in obtaining professional development. The benefits of mentorship are: it can recruit and retain staff, promotes continued professional growth, and the organizations and patients will benefit from an engaged workforce and improved quality of care. And mentorship may improve self-confidence on the nurses. And nurses will increase their job satisfaction and may be able to produce quality patient care. There were challenges of mentorship towards nurses during pandemic. First is relationship factors. Many respondents indicated that they found it challenging to connect in meaningful ways with their mentees due to the sudden forced reliance on video conferencing platforms such as Zoom. This manifested in the form of difficulty with nonverbal communication during remote mentoring and differing levels of engagement across mentees when using remote mentoring modalities. And some mentors experience additional challenges of working with new mentees whom they never met. And some express concerns that they may lose track of mentees during the current pandemic, a related disruption and loss of informal interactions. The second challenges is training or research disruptions. Many remark that their mentees' progress was adversely affected by the pandemic. Pausing of in-person research activities afford diversion to COVID-19 related research and the inability to present at professional conference. Third is uncertainty of future, where respondents indicated that the unknown timeline of how long COVID-related disruptions would last contributed to the challenges in working with mentees during the pandemic, and it can raise the potential threat to future employment opportunities for mentees. Fourth is well-being, where many mentors express concern about the psychological well-being of their mentees as well as their own. And these concerns were linked to social isolation, lack of progress in formal work, COVID-related fears, uncertainty of the future, and the social and political unrest that continue to accompany the pandemic. The rippling impact of the coronavirus has left many with a feeling of fear, worry, and devastation. People are reacting to the pandemic in different ways. Some are meticulously checking things off their to-do list, while others complain of lack of focus, and productivity. And this is the ideal time to reimagine how we mentor in the workplace, team strategizations, and decrease face time. As what Dr. Ruth Grotian 2021 mentioned, that there are 4 steps of strategies to nursing mentorship during pandemic. Of time to process their new reality. Second step is lower expectations. Start small and lower expectations for yourself and your trainees. COVID-19 is taking an emotional toll on everyone and might cause us to transfer our stress onto others, often in the form of poor communication and emotional reactions. Don't demand heightened productivity from yourself or your trainees. Break things down into small pieces. This is a great time to collaborate. Third step is focus on what is important. Most importantly, remember the human and empathetic part of the mentoring relationship. Focus on what is important to the trainee at this time. Consider their safety, specifically their physical, emotional, and psychological state, and prioritize helping them to improve that in your role as a mentor. And the last step is lead by an example. Recognize that your trainee is watching you. Engage them in conversation about what is and is not working for you and what you are trying to do to reduce your own stress while improving your productivity. Talk about how you plan to get off perfectionism, balance an overwhelming workload, and find your voice and create social bonds with others. Because by setting them an example, you are letting them know that challenges are normal and you are working to create a safe environment in which everyone, including yourself, can be authentic. And now, here we come to the recommendations towards nurses during pandemic. First is to stay calm. Remind yourself, your leaders, that frontline staff will follow our lead. Leaders are in a fishbowl. Staff watch leadership and model behavior. They see role model. It is similar to a toddler looking to their mother. When they fall and get injured, our actions will guide their reactions. And second is communicate. Communicate through emails, WhatsApp, Zoom meetings, whatever you need to do, do it and make it happen. And most importantly, be consistent. Managers are looking for guidance and information to reassure them that are fully informed. If they are informed, they will most likely remain confident in the message and the next steps they need to take. The next recommendation is support. One of the things you might hear say is, we have to love them through its leadership. Is hard, and holding a team accountable is not wrong. However, loving them through transition and challenge is needed. Hearing the voice of the trainee is important. Everyone deserves a voice. All levels of nurse leadership learn to feel valued and relevant to provide input and ideas to help us to be the most successful. And the fourth is coordinate. Frequent coordination, physicians, support services, and operational leaders will most likely yield higher quality and a safer environment. Alignment and trust among the senior leadership team will support more efficient planning session and a healthier work environment. And last but not least, self-care. Self-care, consistent with the prior theme of mentor well-being, several respondents noted the importance of mentor self-care during times of stress, with the implication that if mentors do not take care of themselves, they will not be an effective resource nor source of support for mentees. So as in conclusion, crisis present nurses with numerous challenges and opportunities. In the coronavirus pandemic, leadership at all levels is put to the test. Millennial nurses with mentoring guidance must assess their leadership potential and contribute to change and solutions to managing scarce resources. They are key stakeholders in this crisis and their voices must be heard. As Florence Nightingale says, let us each and all realizing the importance of our influence on others, stand shoulder to shoulder and not alone in good cause. This is my references. If you have any question, you can just type in the chat box and don't forget to fill out the evaluation form. Thank you for your attention.
Thank you, Ms. Lini. It was a very interesting and insightful presentation. So if you have a question for Ms. Lini, please do not hesitate to just key it into the chat box. Ms. Lini will be happy to answer you. Before I introduce the next speaker, there was a question, two questions actually posted to me. The first question was about recommendation to avoid confusion in the usage of multi-lumen. Now, the best practice to avoid confusion as in the ICU setup, normally we label each tubing. If we are using the multi-lumen with multiple tubing, each tubing are required to be labeled specifically to avoid misused or missed drugs given that it shouldn't be given through that drugs. And as nurses, I think like what we learn from school, even until after when we work, we always practice double checking for drugs, right? When we prepared, even before we give. So it's the same. I would recommend it would be the best practice as well, if can, before you give any drugs, IV drugs, especially to be given through the multi-lumen extension, it would be best to have a two-person check of each tubing to ensure that it is the correct tubing without mixing with other drugs-to-drugs interaction that causes adverse event that we would not want to happen. Yeah. So as nurses, I think it is we should know as well, drugs and drugs cannot be mixed, certain drugs, and it is the best double check with another colleague before you give the medication. That is to avoid the confusion in multi-lumen setup practice. The second question is from Ms. Xia. Ms. Xia asked about, is there any increased incident of medication errors during the pandemic? I'm not so sure about other hospital practices, but during the lockdown, there was an incident happen to the extent of how high or how many incidents during the pandemic. That one, I don't have the data yet. So I think, Ms. Xia, it is very timely that if deeper study can be conducted to do research to find out during this crisis time, especially during the 2 years period of lockdown, whether the number has increased or not. The reason why I was not able to get the data of this incident during the pandemic is that we are very shortage of staff as well, and we were being redeployed and deployed to the extent to manage COVID situation. So that is, I hope I answered your question. It is a good time to conduct a study for that question. Thank you, Ms. Xia. So the next speaker, before I forget, let's move on to the next speaker. I would like to introduce you Ms. Evelyn Mondala. Ms. Evelyn is a registered nurse with 18 years of experience, 4 years of which were spent in teaching at Master Skill College in Kota Kinabalu. She is currently employed at Singapore Mount Elizabeth Novena Hospital. She received her diploma in nursing from Penang Adventist in 2005, her bachelor degrees from Monash University in 2010, and an advanced diploma in medical surgical from Nanyang Polytechnic, Singapore in 2019. Ladies and gentlemen, please join me in welcoming Ms. Evelyn Mondala. Over to you, Ms. Evelyn.
Thank you, Janet, for the kind introductions. Good afternoon to Dr. Duke, Dr. Noreen, Madam Josephine, and my fellow colleagues and all the participants that joining today. Thank you so much for joining us. So my topic for today is nursing education's approach during the COVID-19 pandemic. So I believe that nursing education is very important in preparing our future young nurses in their career, apart from their passion to serve the sick people. And good quality of nursing education is essential to prepare the nurses in providing quality nursing care for the patients. So in these presentations, my objective is to explore what is the challenges in nursing education during the pandemic. And I will discuss also the nursing education approaches used during the pandemic. And we also will explore the effect of the current nursing education approaches during the pandemic. Well, none of us prepare for the pandemic, and we never expect it can happen and it can affect us this far. And as we know, most of the major sectors in all the countries are affected. The COVID-19 crisis has an unprecedented impact on education and learning as well. In fact, more than 90% of students globally were disrupted by school closure when the pandemic struck. The College of Nursing have to cancel and postpone the student assessment and their clinical placement according to the rules. And new graduates have less job opportunity as well. The education sector must then look for immediate solutions and a new way in teaching and learning. And one of it is e-learning was a preferred option. Okay, before I further my presentations, let me just quickly bring you and look back how is nursing educations look like before the pandemic and to compare nursing educations during the pandemic. I believe you're very familiar with this. Before the pandemic, nursing students are like any other students attending their classes in their classroom. and students attending their practical sessions in the skill lab with no social distancing applied. And students are freely moving around and practice in their own space. And students, they also attend their clinical posting in the assigned ward or hospital. And in the end of the course, the student will celebrate their hard work in the graduation ceremony. So what happened during the pandemic? I think this is very familiar to all of us as well. And many students have to attend class from home. They are not allowed to attend school, and the teachers also have to teach from their own laptop, and educators have to crack their head in creating a new way in delivering the topics, especially the topic with clinical procedure involved. And all must be done virtually. Same goes to graduations. It's very sad they have to do it virtually as well. A lot of my friends who were completed their degree in nursing feel very disappointed as the school decided no graduations with the reasons of the SOP applied. It's a very sad situation, especially those students who were looking forward for graduations. Slide tidak move. Slide tidak move. Object start sharing. Sorry for the interruptions. I understand that the slide is not moving. Stop sharing. I'm very sorry for the technical issue. Coba di sini.
Okay, so sorry for the technical issue. I think we should come back to Miss Evelyn later. So without delay the time, I would like now to proceed to the next speaker, Miss Anastasia Anak Jumbot. Miss Anastasia has 14 years of experience in nursing professions. Currently, she is working at Gleneagles, Brunei as senior staff nurse. She possesses a bachelor degree in nursing in 2020. Ladies and gentlemen, please welcome Anastasia Anak Jumbot. Over to you, Miss Anas.
Thank you, Madam Suchen, for kind introduction. Good afternoon, Dr. Noreen, Dr. Jill, Madam Josephine, audience, ladies and gentlemen. Today, I am presenting a topic entitled Quality Improvement in Reducing Pressure Injury Occurrence in the ICU. For this project, I create a team in order to generate ideas and make this project success. Outline of my topic today are introduction, solution approach, outcome, sustainability, and conclusion. Pressure injury defined as an area of localized damage to the skin and underlying tissue caused by pressure, shear, friction, and or a combination of these. It also commonly referred to as bed sore, pressure damage, pressure injury, and decubitus ulcer. Every year, 2.5 million patients develop a pressure injury, and it costs as much as $11 billion each year. For each patient, it costs about $20,900 to $151,700 per pressure injury. The reason of this project is because increase of pressure injury occurrence in the ICU from 2016 to 2018. This slide illustrates a graph of pressure injury occurrence percentage in our hospital. And this number make me and my team worried that it will give impact to patient, staff, and organization. Aim for this project is to reduce pressure injury occurrence in intensive care unit by 60% in the end of the year 2019. In this slide, we complete a cause and effect diagram to identify why is there an increase in pressure injury occurrence in ICU. The root cause analysis identified are method, people, equipment, and management. In the next slide, I will discuss solution approach for this project. The first problem is patient. Patient with moisture and incontinence problem. Intervention that we do is to keep the patient's skin clean and dry. We use barrier cream to protect patient's skin. Terminate usage of diapers unless patient having diarrhea. Patient with a problem of obesity and malnutrition, we refer them to dietitian based on their nutritional assessment score. Make sure patient well hydrated. Increase calorie and protein intake, especially for patient malnutrition and have pressure injury. Patients have problem with mobility and unstable. We strictly do 2-hour litany. Put pillows in between body parts that press against source of pressure. Next solution approach related to the staff. From the problem identified, staff are exhausted, overloaded, and have time constraint to commit with 2-hour litany. Therefore, we encourage our staff work as a team. Use turning clock as a guide to position patient and recruit new staff to reduce staff burden. Aside from that, we identify few staff still lack of knowledge. So we create staff awareness on guidelines, policies, assessment tools, and care planning during meetings and huddle. Training includes updates for pressure injury prevention and management. Next, we introduce a champion for pressure injury in the unit to guide the staff, promote skin bundles across the unit by using poster. The next problem related to method. For inadequate training, we introduce pressure injury champion to guide staff about the prevention and management. Then, for improper moving and lifting, we conduct manual handling training and prevention pressure injury for all ICU staff. Next, inadequate of burden assessment tool, leadership in the unit to monitor the compliance, implementation planning of skin protocol. Make sure initial assessment and reassessment done accordingly. This is assessment form used in our hospital. Pressure injury assessment is at item number 10. After the scoring, attended nurse need to continue with this form subsequently. Then, if the pressure score more than 15, nurse should fill up a skin bundle form for prevention as required. So, next problem is equipment. We identified that non-compliant on usage of available equipment. So, we ensure all high-risk patients put on Ripple mattress. We reassess non-compliant on equipment and device such as slippery Sally and hoist during moving and lifting patient. For insufficient and inappropriate skin barrier, we ensure staff apply barrier cream and Cavilon spray and use Elavine over prominent area to relieve pressure. Last problem we identify is management. For management of patient with sedation and prolonged ventilation, we intervene this with sedation vacation. Wean patient ventilation support as soon as possible when patient stable with advice and doctor's order. Patient with high inotrope, we wean as much as possible, minimizing vasoconstriction inotrope as it can reduce blood circulation and cause peripheral damage. Patient with cardiac support or unstable, example, patient on ECMO or IBP, we do 2-hourly turning. They need gentle handling. Continue assessment to win the cardiac support. This slide illustrates an outcome graph show a reduction of pressure injury occurrence in January to June 2019 after the intervention. This graph illustrates pressure injury occurrence before and after intervention. The red line indicates when we start the intervention. For sustainability, disseminate new information, update dressing technique and material practice, make sure care is performed and documented. Continue to conduct training and refresher course in pressure injury prevention for all staff across the hospital. Train new staff in pressure injury prevention practice using a skin care bundle for all high-risk patients. In conclusion, pressure injury occurrences are eventable in hospital care and considered to be one of the challenges faced by our hospital, especially in the ICU setting. Multiple risk factors were identified to be the cause of pressure injuries. New strategies mentioned has proven to improve nursing care and reduce the pressure injury occurrence in the ICU. Thank you for your attention. If you have any question, you may put in the chat box. This is my reference. Thank you.
Thank you, Ms. Anastasia. It was a very edifying and insightful presentations. And if you want more information about presentations, please enter your questions, comment, or recommendations in the chat box. Here there are two questions for Ms. Lini. It sounds like this. If Ms. Lini, if experienced nurse and newly joined your hospital, do you provide mentorship program as well? How long the program?
Thank you for the question, Ms. Anastasia. Yes, we have a mentorship program for the newly joined nurses. It takes about 3 to 6 months.
And the other questions, I think Ms. Lini already answered inside the chat box for Ms. Sia.
Thank you, Ms. Sia, for the question. In my workplace, the challenge that I found is training disruptions, where before COVID, we do have a physical face-to-face theory class, but then because of COVID, it is limited and it is hard to monitor the mentees' progress and also their well-being. So that is the challenge that I found.
Thank you, Ms. Lini. And now we are come back to Ms. Evelyn Mondala. Over to you, Ms. Eve.
Good afternoon again to all, especially to Dr. Duke, Dr. Noreen, Madam Josephine, my fellow colleagues and all the participants. Again, I apologize for the technical issue. Okay, so I will repeat again my presentations. My topic for today is nursing education's approach during the COVID-19 pandemic. And my objective for today is to explore the challenges in nursing educations during the COVID-19 pandemic, to discuss the nursing education's approach during COVID-19 pandemic, and to explore the effect of the current nursing education's approaches. I believe that nursing education is very important in preparing our future young nurses in their career, apart from their passions to serve the people. So good quality of nursing education is essential to prepare the nurses in providing quality nursing care for the patients. Okay, none of us actually prepared for the pandemic, and we never expect it can affect us this far. And as we know, most of the major sectors in all the countries are affected. The COVID-19 crisis has had an unprecedented impact on education and learning as well. In fact, more than 90% students globally were disrupted by school closure when the pandemic struck. And the College of Nursing have to cancel or postpone student assessment and clinical posting and or clinical placement, and less job opportunity for new graduates as well. So the nursing educators or the lecturers have to find a new way or alternative way in teaching and learning. So e-learning was the preferred option. Okay, let me quickly bring you again to look back how is nursing educations look like before and during the COVID-19 pandemic. Okay, before the pandemic, nursing students are attending their class as usual, and they have their clinical practice in the skill lab, no social distancing applied, and students are freely moving around and practice in their own space. And students also able to attend the clinical posting in the assigned ward or hospital. So in the end of their courses, the student will celebrate the hard work in the graduation ceremony. So what happened during the pandemic? Most students have to attend class from home. They are not allowed to attend school. And the educators, the lecturers, the teachers have to teach from their own laptop instead. So educators have to crack their head in creating a new way in delivering the topics, especially the topic with clinical procedure involved. So basically all must be done virtually. Same goes to graduations. They also have to do it virtually. A lot of my friends actually who were completed their degree in nursing feel very disappointed as the school decided no graduations with the reason of the MCO, the SOP applied. So it's a very sad situation, especially those students that are looking forward for their graduations. So now I will go a little bit deeper on the students' experience. And one of the qualitative study that conducted by Cengiz et al. In Turkey, the study mainly to identify the challenges experienced by nursing students during the COVID-19 pandemic. There are 5 themes they had identified. The first one is psychological challenges. We might thought that students will be very happy as there are no need to go to school, but actually they feel very stressed. They're anxious because they have no idea what will happen with their future. They feel uncertain whether taking up nursing course is a good idea or not. And students also become quiet and introvert. They don't want to talk. And some of them even have behavioral changes. And one of it is obsessive behaviors. And obsessive behavior is when they have a repetitive routine like tidy up things, keep washing their hands. And students, they feel overwhelmed and lead to sleeping disorder as well. But sleep disorder mainly is because of excessive use of the internet, and the sleeping pattern become upside down. The next challenge is the student feel uncertain with online educations, and they feel that online lessons is not efficient. Yes, personally, I agree that at a certain level, traditional learning is still better. And some students actually, they are working very hard and they realize that all students pass the exam somehow. So they start to thinking whether the exam system is fair or not. The third challenge is students feel their social life is over because they cannot go out and meet their friends. So all depends on digital. Then in the end of the day, everyone is too dependent on internet. So some even becomes addicted to it. Then they say they cannot live without internet. Then the fourth challenge is family conflicts. I think this is also a major challenge globally. Family conflicts and violence actually increased during the pandemic. And in these studies, one of the students mentions that because they have a lot of time to think and always fight with their parent, even for a small reason. But interestingly, in addition to the many negative feedback, some students had positive feedback also. They turned the crisis into an opportunity. This opportunity to learn something new for their personal development, being an array of school models, whether in person, hybrid, and there are continuous debate whether we should open or close the school. What is the new normal in nursing educations? Well, one important lesson has been that one size fits all does not apply here. There is a lot of way and method in delivering the educations. but I'm very amazed how the lecturers, the educators who have been proactive and move quickly in addressing student needs. So education's online, we are able to expand the boundaries of those we can reach and how we engage with them. Now the physical space doesn't matter anymore. They can create a smaller discussion sections and don't have to worry about finding classroom. Now every student is in a front row. We can see everyone's face clearly, and the kinds of interactions that they can have is different. And the most important is that the human connections. So this is some of the lists they can use in online educations. They can use pre-recorded video lectures, electronic book, social media outlets, video conferencing, and virtual classroom. And this is the famous one, the video conferencing apps, the Zoom, like what we're using right now. You can use Skype, Google Meet, Teams, and Kisco WebEx. Some of the colleges using blended educations. So basically the educators or the teacher, the lecturers identify some of their students that have no Wi-Fi or computer or laptops at home, and those staying at rural areas. These identified students will be attending classes in the school as usual. So the rest of the students will attend the class virtually. How about clinical session, clinical practical sessions? So clinical simulations in nursing by using high-tech mannequin. I believe most of the nursing school, they have this mannequin. I remember previously in master skill college that I teach, we have this Menti-Man, they call it. And clinical stimulations is not something new in education actually. It's just a matter whether they are fully utilize it or not. And some of the studies mentioned that using simulated clinical environments to teach difficult clinical concept and skill is a current goal in nursing educations. And all nursing schools are encouraged to make full use of the clinical simulations in the teaching. And it is actually very effective, especially during this pandemic. And clinical simulations also can be used in high clinical settings such as maternity and also pediatric. The key success of clinical simulations are flexibility and creativity. Educator needs to create variable of scenario and skill practice, teaching, and clinical reasoning. But due to the restrictions, only 3 or 4 students allowed for each sessions, and students have to rotate. What happened to the rest of the students? Well, they still can attend the session virtually. The advantage of clinical stimulation is the debriefing session. Students have more time to reflect and ask more questions and more reflection. And clinical simulations can also involve pre and post simulations, for example, like quizzes, and students can learn how to do documentations correctly. Okay, some studies actually suggesting all virtual simulations hours to be considered part of the program hours. And the study also suggesting to include clinical simulation as part of the clinical hours because the simulations session actually is very intensive and it is interactive learning as well. So nursing educations might back to normal soon. We don't know. Maybe. So at the meantime, we have to make some assumptions about the challenges we might face in the future. So if online educations will be continued, we must look into the internet access for every student and the educators, just like what happened to me just now, a lot of interruptions. And the gadget and devices, the nursing school might consider maybe to provide every student a laptop, and the educators might need some training in IT skill and making the teaching sessions smoothly. And those students that have no online resources, no Wi-Fi, no data, the educators need to think about how to reach the students and provide them the materials. And the student might not ready to go through this as well. But how about school? Whether the school itself is ready or not, whether there is enough classroom for the students or not. School must watch on the social distancing and school sanitations as well. We need to assess the risk for in-school transmissions and the quality of infection control, and even in each classroom and each hallway. This is looking and making many micro decisions rather than being able to say across the board what is possible for school. Well, whether the school is ready or not, the education must go on. Students must complete their studies and clinical placement. Although it is very challenging during the pandemic, but COVID-19 pandemic forced nursing education to enter into another level in education. And I can say it is one of the greatest intervention in educations. So I end my presentations with some thought for all of us to think about. No one education style fits for all, and we can always think of a new way in delivering the nursing knowledge. And during the pandemic also, we realized that distance is no longer the matter. Just like the COVID-19, the virus can travel around the world, so we also can reach our educators and students everywhere. And the pandemic allows educators to show their talents and to go deeper, create space, to form relationship, build communities, and engaging in deeper learning. So I end this presentation by saying thank you so much for your attention. And again, I apologize for the technical issue. And if you have any questions, feel free to leave your questions in the chat box. Thank you.
Thank you, Ms. Evelyn. It was a very educational and enlightening presentations. Again, if you have any questions, you can put inside the chat box and the speaker would be pleased to answer your questions. Now, there is a question addressed to Ms. Anastasia. Your project is very interesting. However, can you have a more specific interventions which has shown a more significant improvement in pressure injury preventations?
Okay, thank you, Ms. Sia, for your question. Actually, in this project, if you notice that in all problems that I have shown, the most effective way is through training and education to the staff. So what we do is before the training itself, actually we have a lot of problem. The staff said, I not understand this form, all that. And then we go through this all through training and education. We keep on reinforce. Then we, with the championship, not only in ICU, now also in all unit itself. I mean, for example, we have 3 units actually in our hospital, that is general ward, ICU, and CCU. So all these 3 units, we have championship for each unit. So when we implement, after we implement all this training, aggressive training and education, it's really works actually. It really works. The staff is more aware why it's so important that pressure injury might have a big impact to everyone. If patients stuck in the hospital, it will be, patient can be so long in the hospital. So that is the most the most intervention that we do. Aside from that, we have a kind of, for example, like last time, the patient on ventilator, after post-op, sometimes the doctors will keep it overnight. But now, with education and training again, and not only to the nurse, we do to the doctors. So the doctors also agreed that for all patients, we have this early extubation kind of criteria. So with this early extubation, so it's really reduce the stay of the patient in ICU especially. So I hope Miss Sia, I answer your question. Thank you.
Thank you, Miss Anastasia. Ladies and gentlemen, I would like to inform you that the link to the evaluation form has been posted in the chat box. Please complete the form in order to receive your e-certificate. Now, let's now turn our attention to the next speaker, Ms. Michelle Sim Hui Lian. Ms. Michelle is a certified nurse with 6 years of experience in the operating room at Brunei's Jerotong Park Medical Center. She earned a diploma in nursing from National Integrated Health Science College in Selangor in 2015. In 2020, she attained her Bachelor of Science in Nursing at Lincoln University. Ladies and gentlemen, please welcome Ms. Michelle Sim.
Is it a slideshow? Sorry.
I'm not yet.
Okay. Sorry for the technical problem. Is it a slideshow now?
Not yet. Few PowerPoints. Yeah.
No slideshow.
Now? Now?
Yes.
Thank you. Sorry
Have you
for
shared the
waiting.
sound?
Sound already.
All right.
Hello, good afternoon to everyone. Thank you, Madam Suchin, for the introduction. Good afternoon to Dr. Duke, Dr. Noreen, Madam Josephine, and everyone. Thank you so much to attend our seminar today. So the title for my topic is Improve Nurses Safety by Wearing Proper Personal Protection Equipment During Pandemic. For the objective of my topic is to define the importance of wearing personal protective equipment, discuss the proper way of using donning of PPE, discuss the proper way of removal PPE. So what is PPE? PPE is a short form for personal protective equipment. PPE is a protective gear to safeguard the health of staff by minimizing the exposure to infection and contamination. PPE is a specialized clothing or equipment worn for protection against dangerous or infection materials. The components of PPE include glove, goggle, gown, cap, shoes cover, and mask or respiratory. For the introduction, according to the Beam et al. 2011, PPE acts as a physical barrier that prevents healthcare staff from becoming contaminated with blood and other bodily fluids, including infection airborne particles. And according to the Fisher et al. 2015, PPE is an effective antiviral therapy or prophylactic agent available. The pandemic underlined the role of and reliance on PPE, as well as the importance of its appropriate use and removal.
Hi, Michelle. Can you please on your camera?
Okay. Sorry. So I'm going to show you donning and doffing PPE step according to the CDC guideline I recommended. For donning PPE, before start donning, make sure hand hygiene is being done. The first PPE to be donned is isolation gown, followed with mask, goggle, and last is glove. Make sure to don the PPE properly to reduce infection and contamination. For doffing PPE, the first one to remove is glove because glove considered the most dirty PPE among all. Continue with isolation gown, goggle or face shield, then last with the mask. And make sure to do hand hygiene after remove all the PPE because all the PPE is dirty and contaminated. Here I'm going to show you a short video about the guideline of donning and doffing PPE.
Here are the 4 steps to donning and doffing personal protective equipment. To optimize the performance of PPE, it is important to ensure the proper procedures are always being followed. To reduce the risk of transmission, tie back hair and remove jewelry. Start performing hand hygiene with an alcohol-based sanitizer for 15 to 20 seconds, or with soap and water. Rub hands together palm to palm. Rub the back of the hands. Rub between the fingers, as well as fingertips and nail beds. First, inspect the gown for any damage or presence of holes or tears. Don the gown by putting it on one arm at a time, ensuring that you are fully covered from neck to knees. Secure the gown by making bows that can easily be untied at the back of the neck and waist. Make sure that both strings have been tied so that the back is adequately covered to prevent accidental contamination. Position the mask by lifting the chin and placing it over the nose and mouth. Stretch the bottom elastic over the head to the back of the neck. Then stretch the top elastic band at the crown of the head. Check that the mask fits snugly around the face by running the fingers along the edges. Mold the metal nose strip to conform to the shape of the nose. And perform a seal check by placing the hands at the top and bottom while taking deep breaths to feel if any air escapes. Don the face shield by placing the strap at the back of the head. Make sure that the top of the shield is resting on the middle of the forehead. Put on the gloves, making sure that they are snug over the gown's cuffs and that no skin is exposed. The doffing process poses the highest risk of transmission. Take your time to safely remove the PPE so you do not contaminate yourself and your environment. Remove the first glove by pinching the outside near the wrist. Then peel it downwards, pulling it inside out. Hold it in the other hand and slide a finger under the wrist of the remaining glove to peel it off, turning it inside out and balling up both gloves together. Remove the gown by untying the strings at the neck first, followed by those at the waist, as they are more likely to be contaminated. Pull on the fabric at the neck so that the outer contaminated side of the gown is pulled away from you and turned inward. Then, roll the gown off the arms into a bundle. Place the gown into the laundry hamper in a manner that minimizes air disturbances. Remove the face shield by pulling the strap. Remove the mask by pulling it forward and holding it away from the face. Pull the bottom strap first and then the top. Know the steps and stay safe.
PPE is a universal standard precaution to minimize infection and contamination. PPE also acts as a shield against harmful bacteria, virus, and infection between healthcare worker and patient, as germs can spread through contact, droplet, and airborne. That's why wearing proper PPE can help us to protect healthcare worker and patient by preventing spreading infection to others. For the conclusion, effective use of PPE protect nurses, patients, and healthcare facilities from the spread of transmissible pathogens. Donning and doffing of PPE is a vital step in reducing contamination and improve safety of healthcare workers caring for patients with transmissible infection disease. This is critical to mitigating spread and maintaining the healthcare workforce. So this is my reference. And if you have any question, you can chat in the chat box. Thank you so much, everyone.
Thank you, Ms. Michelle. It was a very informative, insightful presentations. Again, if you have any questions, you can post in the chat box. The speaker will be pleased to answer your questions. And now there are two questions addressed to Ms. Evelyn. Right. The first question is, how do you decide on the students' attendance during class since class is being conducted online and students perhaps can say their internet is not stable?
Hi, thank you for the questions. Okay, I know this is very challenging. So what we normally do is we will check on the participant list. And the second, we will ask them to open up the camera and we take screenshot of the photo. And another way is to ask the student to write the reflections. Yeah, I believe a lot of educators also find it a bit difficult to check whether the student is really attending the class or not. But this is a few ways that we can do it. I hope, Janet, I answer your question.
And the next question is, as one of the educators, what are the hardest parts while we are still on pandemic and continue using our unstable data or Wi-Fi? How do you give scores on students?
Yes, thank you, Joanne, for the questions. Yeah, I know a lot of educators actually face this problem. So as I said, there's no one way that fit all. So one of it, we can play with Google Form. We can create a questions through Google Form and send to the student to answer. But those students that have no Wi-Fi or internet, one of it is what we can do is create a questions and send to them via using PDF form. And we ask them to WhatsApp. Yeah, WhatsApp to ask the question. I mean the answer. And about the scoring mark for MCQ assessment, again, I suggest using the Google form. And another method that we can ask them to, we can assess the student is through their presentations method. Yeah, they can present and they can write a reflection as well. So we mark through their presentations and reflections. For skill, what we can do is we can ask the student to record themselves doing the procedure and send back to the lecturers. Or if the student have a Wi-Fi, then actually you can practice online. I hope I can answer your questions, Ms. Joanne. Thank you so much.
Thank you, Ms. Evelyn. Ladies and gentlemen, again, I would like to inform you that the link to the evaluation form has been posted in the chat box, and please complete the form in order to receive your e-certificate. Now, I would like to invite Dr. Noreen Jones to give a few words. Dr. Noreen? I'm sorry, Dr. Noreen, you need to unmute.
Okay. Thank you, Ms. Chung, giving me this another opportunity to address to the audience. Thank you to all the distinguished speakers for the informative presentations, and it was very interesting and inspiring. Yeah, and for ladies and gentlemen, I really appreciate that you're present today. From the virtual conference, I saw my friends here. Alicia, Rina, are you all still here? Thank you. Emilia, thank you for being with us throughout this webinar. And thank you for your support. Let us move together in nursing, my friends, to my three friends and other friends and all the audience here. Let us move together in nursing. And with this opportunity, I want to inform you that Lincoln University, we're going to have an intake for PhD in nursing. The PhD in nursing, the intake is ongoing. Every month we have intake. Those who wish to continue in PhD in nursing, please do so. Yeah, and also we have Master in Nursing intake in April. There will be one, and July and October. For Lincoln University, for your information, we have 4 programs that we offer to the nurses: Master in Nursing Educations, Master in Nursing Midwifery, Master in Nursing Public Health Nursing, Public Health, Master in Nursing by Research. There are 4. So, as I said just now, we have intake in April, we have July and October. And we do have a nursing, we do have training also for the Bachelor's Science in Nursing Honors. The intake is in, the coming one is in May, and another one in September 2022. For your information, these courses are all, we conduct it online. So this means we bring the education right to your home, okay? So I wish we move together in nursing, okay? So if you're interested to join, and you can always contact me and my colleague, my staff, my colleague in Sabah office, and the numbers and the emails is stated already in the chat box. Thank you, Chong. Thank you, Ms. Chong, for this opportunity. Thank you. Yeah. Thank you so much.
Thank you, Dr. Noreen.
Yeah.
If there is no questions for anymore, now let us next in the proceeding is my honors to invite our next guest, Prof. Dr. Rekido Dioso, to deliver his closing remarks. Ladies and gentlemen, please join me in welcoming Dr. Rekido Dioso.
Thank you very much. Thank you very much, Suchin, Miss Suchin, and all our participants. So, first and foremost, I would like to express my appreciation to the speakers for their valuable contribution to our webinar, and participants and very important guests, and also thank you to Dr. Noreen and Matron Josephine for helping on making this webinar successful. Therefore, congratulations to us all for successfully completing this webinar and achieving its aims. Hearing and learning from speakers as well as the participants' questions and comments has educated me and all of us here on how to help promote connectivity on patient care delivery and the education realm. It is important to understand the views of academic experts on the latest care delivery for nurses and healthcare professionals. In my capacity as facilitator of this event, I thought it would be appropriate and useful to reiterate some of the themes as well as ideas emanating from this webinar. So the theme is the quality of patient care. We have heard a lot of interventions for quality of patient care, especially on educating the undergraduate nurses in order for them to continue their professional development. Lincoln University will be on top of this theme, and all this raises the obvious question of what could or should be the role of Lincoln University College in addressing some of these important issues. The answer is to educate. Despite the pandemic, lockdown, and movement control orders for all educational institutions worldwide, Lincoln University College still pursued educating globally. And this act is to improve the delivery of skills, develop the attitude, and synthesize new theoretical knowledge at all levels. And the benefits of improving knowledge and continuously developing an individual's profession outweighs the challenges of the pandemic. So enroll now at Lincoln University College and contribute to the academic realm. And for my final message, I once again congratulate every one of us for successfully completing this webinar and achieving its aim. Thank you very much. Congratulations, everyone.
Thank you, Prof. Dr. Rekidol, for the encouraging remarks. Next, we would like to invite everyone to please switch on your camera for a group photo. Right. Come, let's switch on our camera for a group photo. Thank you. Dr. Jill, are you taking a photo, is it?
We are done with the group photo.
Thank you.
Thank you, Dr.
Thank
Jill.
you. Thank you,
And
everyone.
ladies and gentlemen, this webinar session has officially come to the end. We would like to thank all of the presenters for their excellent presentation, as well as everyone in the audience for their active engagement. I hope that you found today's talk educational and useful. It has been a pleasure having you with us during these webinar sessions. And on behalf of Lincoln University College and our presenter, thank you for spending time with us today and making today's event memorable. Have a great evening, everyone. Thank you.
And please be reminded again, do not forget to fill up the feedback form, the evaluation form for your e-certificate. And please make sure that your email is correct, your full name is correctly spelled out as well. Thank you.
Bye, everyone.
Thank you, Dr. Jill. Thank you, Dr. Noring. Thank you, Dr. Madam
Bye,
Josephine.
everyone.
Thank you, everyone.
Thank
Thank you,
you. Thank you,
everyone.
Soboki. Thank you.
Thank you.